Premiers started their 2 days in Victoria by meeting with national and regional Indigenous leaders and by making it clear a key player isn't here.
I got a text from the Prime Minister this morning. They're aware. They've been working on it. But we can't determine what we're going to do with money we don't have.
The money the premiers say they don't have amounts to $28 billion a year, a shortfall they claim leaves them doing the heavy lifting on health spending.
We're only getting 22% on the average across the country, and it's just not sustainable. If they're paying 22% and we're paying 78%.
They use this fake figure of 22%.
Fake, says the federal government, because it ignores historic transfers of taxing power to the provinces worth $20 billion a year. And because it discounts the big spending Ottawa did during the pandemic to take the burden off the provinces.
Provinces now, in some cases, are running up big surpluses. Some provinces are deciding to send $500 checks to people at the cost of billions of dollars. That money can be used immediately.
The amounts we received during the pandemic were non-recurrent amounts. The $500 I sent to Quebecers is non-recurrent. What we're talking about is recurrent amounts.
It's disingenuous at best to suggest that that the federal government's carrying its load when it comes to funding public health care in Canada. It's just not the case. Now, we can quibble about the numbers, but Canadians will not thank us for that.
Justin Trudeau has promised to meet with the premiers to discuss health funding, but not until the pandemic is over. Now, with most COVID restrictions lifted and the premiers meeting again in person, they say it's time for the Prime Minister to come to the table. David Cochrane, CBC News, Victoria.